Martina wanted us to remind everyone that it was Kamana'o Pono and our next speaker, Joseph Keawe Kaholokula, who did our protocol for the very first PRIDoC in 2002. So another hand for Kamana'o. So, o ke kuni Blaisdell ko umakua kane, o ko'olau kona hopua'a o lani huli kona mauna o ka ua wa'ahila kona wai hana o nalani Blaisdell he wahine. It is my pleasure to introduce Joseph Keawe Kaholokula. He kindly sent me his bio, but it's too small for me to read. I just wanted to say that as far as fast facts, I remember Keawe and Kamana'o coming over to my papa's house and sitting on our lanai and talking about the wonderful things that they wanted to do for Native Hawaiian health that they are doing now. We're all so proud of both of you making wonderful strides for our people. And I know that Kekuhi doesn't like when I say was, so I'll say Papa is very, very, very proud of you. Thank you so much to both of you. Thank you, Auntie Pua. I had the pleasure of meeting Auntie Pua when she won a Major David Malo Award last year. Thank you for all that you share with us. And so without further ado, I'd like to introduce Joseph Keawe Kaholokula, born and raised in Oahu. Auntie Pua always says it takes great intelligence to teach oneself a language as an adult, and Keawe taught himself Hawaiian and is amazingly fluent. He's the chair of the Department of Native Hawaiian Health, and so the chair of all these brilliant people in front of you. So, Keawe.
Velina me kela ia kākou, e nā Kanaka o iwi a me nā Kanaka like ole. Mai ina aina mamau hiki ke ia pai aino Hawaii, a hiki e kia moku o Keawe. Haole wau e noho nei, ke ia aina o ka iewe o ku kupuna waihine, o Violet ke o nanale hala o puna kaloi. Aloha mai kākou. Sorry, I'm getting this thing a little, it's not cooperating. Greetings to everyone from afar as well as from this Pai'ainoa, Hawaii. It's quite an honor to be here. First of all, I want to mahalo the Ahahui o nā Kauka for the invite to come and talk today. They also gave me the topic, which was very helpful. It helps me to focus in on something. But I also like to mahalo halau Kuhi and Tipua for the opening and creating the cultural space for us to be here on this island. I actually, on my maternal side, my lineage here comes from this island of Hawaii, from Puna, where Tutupele is very active. My grandmother and her ancestors were born here, Vale Keonanale Halo Puna Kaloi, and we stand back to Kaloiokalani, which was a chiefess in Puna. So I'm very happy to be here on this moku, speaking about mana that was talked about earlier in Mauliola. My mana increases as well as my Mauliola while I'm here. So aloha mai. So I'll apologize in advance, because up until now, everything was great, cheerful, right? Talking about cultural revitalization and creating the cultural space and Mauliola. And I'm actually going to start off with that and end with that again. But I was asked to talk about the effects of racism on health and well-being for Indigenous people, but I'm going to focus in on Native Hawaiians, Kanaka Maoli, since you're here in Hawaii. Because to cover all Indigenous populations would need more than, now I think I have 10 minutes, right? Went from half hour to 10 minutes. I don't want to keep you folks from lunch. That's the last thing I want to do, is make you folks angry at the end of my talk. So I'll try not to. So I'm going to cover as quickly as I can, but hopefully touch on some things that I think are important. And I'd like to start off, as our previous speakers did, really focusing on our traditions and our concepts of Mauliola, health and well-being from our perspective. But also, you heard a lot of our perspective this morning. So let me give the perspective of Captain James Cook and his men. Not that I think that highly of them, just that they documented something from 1778 that we can point at to say that we were a thriving and healthy populations. And like Dr. Kekuni Blaisdell, father of Nalani, Dr. Nalani Blaisdell, would always tell us, is that we were once a thriving, healthy population. And we have somewhat of evidence here by these firsthand observations of Captain Cook, and Samuel was the physician on board his expedition to Hawaii. And if you read they kept journals, right, of all of their experiences every day, you'll get a glimpse of what it was like in 1778 when they arrived upon our shores. The natives of these islands are in general above middle size and well-made. They walk very gracefully, run nimbly, and are capable of bearing great fatigue. They have very mild and agreeable tempers, and in their dispositions are truly good-natured, social, friendly, and humane, possessing much liveliness, and so on. Mind you, they didn't come during the season of Ku. They came during Lono, so everything was kind of, they came back during Ku, but anyway. But this is, when you look at what was said about our people in 1778 by these Europeans who also thought of us as savages, right, and did write some racist remarks about, and they were quite surprised that we were very civilized, given we were savages. They still wrote these wonderful things about our ancestors. And I look at this as a baseline for what we can achieve as Kanaka Iwi, that we can achieve, again, this ability to be capable of bearing great fatigue. As we all know, the obesity rates in our populations are very high, and therefore diabetes and cardiovascular disease. So it's an issue. You also know that, counter to what many of us have learned, that, unfortunately, people that came after Cook had an agenda. And the agenda was to suppress our culture. The agenda was to pacify the population by changing our belief systems. And part of that was to make us believe that we were in fear for our lives. We were going to be sacrificed to Tutupele. She doesn't like virgins, by the way. But we were told all these things, right? We were told all these things about ourselves, which weren't true. So counter to what was said by the missionaries who came later and others who came here to colonize us, Captain Cook said we were a very mild and agreeable group of people enjoying life. I say that because a lot of what we have come to learn is simply counter to what we know and what we are experiencing today as Kanaka. But we also know that with Captain Cook came others to our shores that drastically changed our world. It altered our systems, not only our religious beliefs and our value systems, it eventually altered our political systems, our social structures and everything. And it affected our health and well-being. And I'm not going to spend time, because we don't have time to go into that. And all of you as indigenous peoples or people who work with indigenous populations, you know the mo'olelo or the stories. It's the same story in Aotearoa, in First Nations Canada, and across the US. It's no different here. There was cultural suppression, political takeover, and we were made second-class citizens at best in our countries. And it affected our health and well-being. First, infectious diseases nearly wiped us out in the 1800s because we didn't have the natural immunities to ward off. We survived that, and now we got the chronic diseases, right? And what do we do with the chronic diseases? We often say it's diseases of lifestyle. We place blame on the individuals. We say that the individual is responsible entirely for their condition. Well, I'm going to present some new ideas, really in the context of a larger, and as presented earlier somewhat, the idea of social and cultural determinants of health. And if you go to the far right, biological, psychological determinants, this is where we spend all our energy, all our training, whether you're a physician, psychologist, social worker, pastor. We focus on learning about helping, most of the times, the individual, maybe the family. We learn our trade, we master it, but we learn a piece of the puzzle, the larger puzzle. We're very good at that piece, but sometimes we also neglect other pieces of the puzzle. But nevertheless, a lot of our resources and energy are spent on what I call Band-Aids, temporary solutions. Because often, you don't go to see someone until you have a problem, and by then it's pretty bad, right? And by then it's a management, treatment management, whether it's psychological, whether it's physical. So as you go further to your left here, we're really talking about the things upstream, what Dr. Crabb had mentioned earlier about going up into that Auai, to the source, to the Punavai. And as you go up there, you see a lot of things really affect our health and well-being, right? It's not just eating healthy. It's not just getting more exercise or reducing our stress. When we live in a state of the U.S. that has the highest, one of the highest place to pay for rentals and mortgage and so forth. And the compensation for us don't match that. So most often people work 2 or 3 jobs. Many professionals in the room probably are in a similar situation because the average cost of a condo in town now is $800,000, and that's just probably, I think, for a 2-bedroom. So there are issues here that for us are challenged by. But if you look at these are the bigger issues that really affect our health and well-being. But I want to focus in on one of them for you. And that's kind of a big one because it actually, although I have it up there under cultural determinants because I'm talking about interpersonal racism, there's also institutional racism that affects our access to goods, to services, and to other things, quality education, for example. But let me focus in a bit for you. Up there, ka Vaiola, ka Malama Nohona, ke Auiwi, ka Hanapono is a more cultural perspective of focusing on these particular areas. And to your far left is more historical determinants. They're non-modifiable. They're things we often talk about, but we can't change. But we need to understand it because it has led to situations that we can change. But we need to understand the source of some of our concerns. But Mauliola is really what we're achieving. And so, Hawaii, I don't know if how many of you have heard this, but there's reports, there's publications for years, for centuries, generations, saying that Hawaii is an ethnic paradise, that Hawaii is the place you want to be, right? It almost forgets and puts aside the situation of Kanaka Maoli in our own homeland. It almost forgets there was an illegal takeover of our country and that Hawaiians lost their ability for land ownership and other things and access to their ancestral lands. It takes away all of this, and it washes away in a multi-ethnic society to say, well, that's all done with. Now you're part of this larger group. But is it really a paradise? The Massey Affair in the 1930s, actually 1931, reminds us of what really was happening in the 1900s. So this is after the illegal overthrow in 1893, going into a territory. Hawaii was a territory before it was a state. Then an incident happened here with the wife of a naval officer, Thalia Massey. She was brutally beaten, raped, and her mother, who was an affluent one from a southern family, encouraged her to blame it on these 5 men, 3 Hawaiian, 2 Japanese men. Let's go blame it on them, people of color, because we can't tell them that a white man raped you. And they went ahead and falsely accused this. And she went even as far, the mother, to send out U.S. naval personnel to go find these men and beat them and beat a confession out of them. One died, a Native Hawaiian man, Joseph Kaholokula. He was murdered. But they did not commit the crime. It made national news across the U.S. It was a big deal. Everyone was saying, those natives, those Asian immigrants, they're savages. Look what they did to this white woman. Never happened. That led to the U.S. Department of Interior following that up with an actual investigation, which is in that book right there, Hawaii and Its Race Problem. I actually came across this book at Powell bookstores in Portland. I didn't even know it existed. It's actually online, so you can get it, parts of it at least. And so this guy from the interior comes down to Hawaii to investigate. He talks to everyone, he looks at everything. In the report, it actually talks about the history of all the different groups to Hawaii, how great everything, and how we're all getting along. And he concludes there's no race problem in Hawaii. This is following this issue. That there is no race. There's a white oligarchy in Hawaii at this time that is dominating society, dominating politics, led by the U.S. naval officers. Because if you recall, Navy was big back then because we had the big Navy. If you had a big Navy back then, you dominated the military, right? So all these things were happening. So what do Kanaka Maoli think about this? See if you can recognize someone up here in the picture, to the far left. Dr. Mililani Traswati is somewhere in the audience. That's her, I believe, at Stanford when she was a student there, protesting against using our images as costumes and so forth. So racism, as we all know, is a chronic social stress that is often unavoidable and sometimes uncontrollable. Unavoidable because sometimes we have to go to work and deal with it. We have to shop certain places or frequent certain restaurants where we might be discriminated against. And it's uncontrollable to some degree because sometimes it's institutionalized, it's out there, it's something beyond our direct control. Nothing is more frustrating than having a stressor that is not within control. It's the belief acts or institutional measures that devalue people because of their phenotype or ethnic and racial affiliations. But when you ask Native Hawaiians, over the last 12 months, over the last year, do you feel like you've been discriminated? It's a multi-item measure around how they have been experiencing society, how they feel as a Native Hawaiian, where they're being valued, or so forth. 48% says, wow, we get a lot of discrimination and racism against us, either often or most of the time. The other 52% says some of the times. None of them in our study said none of the time. They had that option. Now, I ask you, are we living in a multi-ethnic paradise for Native Hawaiians when they are perceiving or experiencing discrimination at this level? Now, the big question is, so what? Is it really affecting us? Let's take a look. There's a lot of research, started out at least in the US, there's also research in New Zealand and elsewhere looking at the effects of racism on health outcomes in different populations. In the US, for a long time, it was mainly around African Americans. Started to get into the Hispanics, now it's getting into the Asians, and now we're getting into the indigenous populations to document the effects on our health and well-being. So there's another pathway to inequities, and that pathway is through these social and cultural determinants of health, such as racism. It's not just simply through lifestyle choices. It's not simply through taking the medication or doing something to elevate your mood. There's real serious things that we need to address. And when you look at racism, whether it's interpersonal or internalized racism, I don't have time to go into it, but it's actually perhaps more damaging than just simply interpersonal racism, has been found associated with an increased risk for all of these issues: mental health, depression, anxiety, substance use, just general psychological distress, negative birth outcomes, especially in African American women. Mainly the research has been in that area. Hypertension, obesity, diabetes, cardiovascular disease, breast cancer, again in African American women. And some of these studies are really large studies, well done, published in very high impact journals, American Journal of Public Health, for example, that has looked at, controlled for all the various factors that could be associated, could explain away the relationship. And the studies are actually getting better and better over time. And we're finding that there is still an association. Now, when you look here in Hawaii, we've been doing this for many years. I actually started off with Kamana'o and I back when he was in grad school, I was in undergrad, trailing him for about 2 years for a while there. And we started looking at acculturation strategies and its effects on depression and diabetes, and we were finding something going on. And Dr. Iwane one day comes into my office, Marcos Awanee, who's in here. I get 10 minutes left, that's perfect. And he walks in, he goes, I need a project, research project. Perfect person for it. Kanaka, well-connected. I said, great idea. I just published a paper looking at acculturation strategies in diabetes care. And guess what we found? If you're a traditional strategy that you strongly and exclusively identify with being Native Hawaiian, you had a higher risk to develop diabetes. This is confirmed diabetes, by the way, from the Native Hawaiian Health Research Project. But we know it's not the identity that's the issue. That's the marker for something else that's the issue. And at the time, I'm looking into the African American literature, and I said, yeah, let's begin to look at that. So Marcus got on board. I'm going to come to a study shortly, but I wanted to share that before I forget. So some of our medical students have been involved in some of our, who are now physicians, have been involved with some of our studies. But Antonio Mapuana, who is just graduated with her doctor in public health, for one of her projects, she looked at the relationship with discrimination, depression in Native Hawaiians. This is a unique sample because it's Hawaiian homestead communities. They're all 50% ancestrally Kanaka, because that's what you need to get onto these lands. They live in a pretty much all Hawaiian community, buffered from others. But we looked at whether or not there's a relationship. And there's no order to the presentation as far as years of which the studies were done. They're more around the groupings of conditions. But we found a positive correlation. When we looked at racism, psychological distress, and coping strategies, because we know from the other literatures that there's something's going on with coping. Sometimes it can buffer, depending on your coping strategy, the negative effects of discrimination. But in other cases, sometimes it can exacerbate or be part of the causal mechanism to psychological distress. And what we found in a sample of about 140 Native Hawaiians using a structural equation modeling approach, we looked at 14 distinct coping strategies, some what you might call positive, like spiritual, talking to a friend perhaps, and some that are called negative or passive coping strategies, which venting, which is kind of like calling a friend, complaining. Behavioral disengagement is kind of like learned helplessness, not even trying to deal with the situation and holding it in. We found that those two served to mediate the relationship between the negative effects of racism on psychological distress in Native Hawaiians. Other than that, if you had other coping strategies that you predominantly used to deal with social stressors, the relationship, there was no significant relationship, a direct relationship. It worked through these two mechanisms, these two coping styles. Another group of colleagues from the Cancer Center, Pakarel and Herzog, looked at Native Hawaiian students, and they were interested in historical trauma, discrimination, and risk for substance use and abuse. And they found something interesting from their path analysis here. And what you can see is that, and they measured, of course, as perceptions of historical trauma, the struggles of their ancestors. I believe it was adapted from American Indian communities. If you look at the top, there's a significant negative correlation, meaning the more historical issues of historical trauma they reported, the less likely they were to use substance use and abuse substance. But when you threw in the discrimination factor, all of a sudden, it's a positive association. So something's going on, right? It's not just the historical trauma itself. We all are aware of the struggles of our ancestors and then the struggles that we continue today. But there's another factor that has to come into play before it becomes problematic. We looked at, this is where Dr. Awanee comes in. We looked at hypertension. Now, again, it's interesting. All of my funded studies are developing community-based interventions, more solution-focused. What I'm presenting is actually a side gig for me, but the most important studies, I think, but because it's hard to get funding to do studies looking at racism, it ends up being more of a side thing. And what we found in an unfunded study, in a small sample, we found an association between reports of hypertension and experience of racism. What was interesting in this study, we also found that stronger American identity led to they were more likely to report having hypertension after adjusting for some social demographics and Hawaiian identity, which tells me that there's something else going on. Because in African Americans, the higher you get up the SES ladder, the socioeconomic status, as you elevate yourself, the relationship between racism and hypertension risk gets stronger, right? Because imagine you work hard to get to the top of your profession just to be treated like everyone else as if you're poor because you're still a person of color. I think something similar is happening to that effect with Native Hawaiians. They're wanting an American dream, but they're meeting resistance either from mainstream because of discrimination or within their ohana because they're wanting to maybe assimilate more than the ohana would like them to. And then McCubbin and Antonio also found an association with obesity. We looked at cortisol, so we're getting down into under the skin, the physiological effects of racism. And we found, what was interesting here, we found a negative association. And then the physicians in the room are going, wow, shouldn't it go up though? Shouldn't the higher cortisol lead to more, the more racism, more elevated cortisol levels? No, not with chronic stressors. Because over time, the body has to compensate allostatic load. You can look at what you want to look at, HPA axes, but the body has to adjust. It's like keeping your car revved up. It can't be revved up too long. And it actually down-regulates. And it no longer functions, the stress response no longer functions the way it should. And the beta coefficients were pretty robust going across the different models after adjusting for different variables that could explain away the relationship. You also find it with other people with PTSD and so forth. This blunted or flattened cortisol response. We looked at systolic blood pressures, actual measure of their blood pressures. There was a relationship, and it was positive, right? The more racism, the higher the blood pressures were on average. But BMI actually attenuated that relationship. As you saw earlier, BMI or obesity seems to be another factor associated with racism, so we think there's something going on there. And then yesterday, Dr. Hermosura had presented some of her work, I think, on her panel. This was actually a study she did for her dissertation, look at cardiovascular reactivity and recovery, because how fast you react and how long it takes you to recover back to baseline after a stressor predicts cardiovascular disease in the future, developing cardiovascular disease. And we wanted to see with Native Hawaiians And we did something a little different. What we did was we looked at subtle versus blatant. So you have to really think about it in order to pick it out, or blatant. And then we categorized them by Hawaiians at baseline who just perceive a lot of discrimination versus those who perceive less around them. Because we thought maybe people who perceive a lot of discrimination, life is just not good all the time. Let's see something. And the effects of that may be different. Long story short, somewhat the effects were the same for both groups, but more so there was a trend for the group that on average, on a regular basis, perceived more discrimination around them. They had a longer recovery time, or a significant recovery phase. Now, I'm pressed for time. So Yin Parodies puts it all together for us from Australia and what might be going on. How does racism lead to psychological issues and also chronic diseases, and how they're interrelated? And there you see two general pathways that are interacting, right? One is through denial of access of goods, not accessing quality education and so forth, that puts us at a disadvantage. But also it puts a wear and tear on the body that may put us in a position, independent of obesity, independent of other known risk factors for a lot of the chronic diseases. So something's going on. And this that Yin did actually encompasses all of the different studies from across the world and putting it together, making sense of it through meta-analyses, other systemic reviews. And he does a great job at this. But I want to end to just say that, going back, that we are resilient, we continue to thrive, we continue to resist, and we'll eventually overcome this. Because what are we doing? We're revitalizing our cultural practices. And we want to. 90% of Hawaiians, regardless of their ethnic admixture, strongly identifies with being Kanaka Maoli, and they're wanting their cultural values and practices to be at the forefront of what we're doing in our communities and in our schools. And I want to end with a positive thing that we're doing, using a cultural grounded approach, using hula, our traditional dance, the dance you saw this morning from Hilo, Kekuhi. We got funding from National Institutes of Health, from National Heart, Lung, and Blood Institute, to look at a cultural practice. I think the first time that a Hawaiian practice looked at scientifically. And 1 minute. And what we found, and we got a 5-year study. This is actually the pilot, by the way. And we're finishing up the 5-year definitive study. But in the pilot that got us the grant, this is what we found. Hula, coupled with 4 hours of education around managing hypertension, so sodium reduction and so forth. But a bulk of it was hula. Kumu Hula, Mapuana de Silva and her halau were really at the forefront of creating the protocols. We went through a lot of effort. We looked at the METs. There's a lot of work that I cannot present for time to get us to this point, but it was a culturally relevant, and the cultural integrity was in place. We had a community advisory group that included Kumu Hula from across different places. And what we found that those who were randomized, so using a waitlist control, who are randomized to receive the intervention compared to those on the waitlist control, significantly reduced their blood pressure. These are confirmed hypertension cases, physician diagnosed. Dr. Todd Sito was a cardiology advisor on this study. And he tells us this is comparable to what you see with multiple medications, exercise, sodium reduction. Through a randomized control trial with Native Hawaiians in a cultural practice. And what we found was, real quickly, is that as a result, and there's Marshallese and Native Hawaiians. Not all of the people were Native Hawaiians in the study. Marshallese is a Micronesian community. We found that in both groups, we saw the same results. And in both groups, we saw an improvement in their perceptions or experience reporting of racism from baseline to completion in the intervention group, but not the control group. So having a cultural-based health promotion strategy may be much better than any other strategy, such as getting a treadmill or going to a gym, because not only does it address the clinical aspects, but it addresses the cultural aspects, the spiritual aspects. And I would argue it's those aspects that lead these people to making the changes we want them to make in their diet, their exercise, and their stress management. It's creating or buffering. We don't know. In the 5-year study, we will know, because we're actually looking at the mechanism by which we'll get these outcomes. And you must be wondering, well, what's the outcomes of the 5-year study with 270 Native Hawaiians? I cannot share with you right now. We can't really say. There's a smile on my face, though. And so I just conclude my concluding remarks to end this is racism does adversely impact both our mental and physical. It gets under our skin to really affect our human stress response that compromises our bodies to put us at risk for diabetes and other chronic diseases. There's a complex interplay between all of these things. It's not what comes first, they're interacting. And based on Yin's model, it seems like there's some psychological distress up front that may be putting us in situations that may put us at risk for chronic disease. And the adverse effects of racism may be modifiable through cultural-based activities, at least at the individual level. It doesn't change what's happening in society. I'm not implying that. There's a lot of work to do in policy and other areas. But at least we can help people in the here and now to feel better about what they're doing, put them in a better cultural context and health promotion, and begin to provide them some buffers against these stressors that they're experiencing in the larger society. So with that, mahalo nui.